So observation for the day, which I wish I would have had a video of this because this was so cool to witness. Yeah, I see it all the time, but what happens when a person comes in with neck tension and I don't work the neck? What do I work? I work the lower core, and what happens? Everything shifts, like literally everything. So client came in, she gets about a week and a half of relief, and then her neck starts hurting. And so right away we check the neck, we check the stiffness of it, then we work the sternum in the what I call a counterbalance to the neck. So if you're having neck tension base of the skull, we're going to work lower rib cage. And we isolated some spots that were tender on her, and then that did help the neck tension. Then we went to the shoulder, did range of motion. It was limited, it felt tight. We went right to the lower core, above the pubic line, above the inguinal line on that left side. Put pressure on that system, and then had her do a Kegel, cross fibered that area 5 times, and then she released the muscle tension, and then the fingers basically went into her tissue like an inch or so, probably maybe 2 inches, and her whole system just completely, her core and her guarding in the pec walls quit guarding. They just basically shut off, which is what we wanted. So then we did range of motion, full range of motion, no pain, no tension. Repeated the same thing on the other side. Tension with range of motion, release the core. We actually had to work more abdominal wall activation, kind of like a side crunch. And then range of motion to the shoulder, improved. Neck tension was full range of motion, no pain. So biggest takeaway is when I'm working on somebody who has neck tension, I do not work the neck. I assess the neck and I figure out where it's tight. I look at the counterbalance of the rib cage, and then I go to the core. It's honestly that simple. It's hard to imagine though that the core, especially the lower core, like above the pubic bone, the muscles that attach to that area will affect the neck. But I see it every day. I have clients that even request core work before I do arms or shoulders or chest or neck because it's that impactful for them. So that's all I'm going to say about this session. It was a great session. Client's super nice. Definitely a lot of muscle imbalances, but the biggest one that she came in with was neck tension, and within the first 10 minutes, probably the first 5 minutes, her neck pain was gone. And it did come back a little bit here and there, but we worked her whole system. We flushed it, we twisted it, we basically almost like we wrung it all out, and she had no neck tension. She came out feeling lighter and energized instead of groggy and tired.